Great. Good morning, everyone. Thank you for joining us. My name is Katerina Panagaki. I am the Health Equity Mainstreaming Lead in the ARC Northwest Coast. And so in discussions with colleagues, whether informally in the corridor or during workshops, the challenges of how to apply an equity lens in evidence synthesis and systematic reviews is a theme that has regularly come up. So I'm very pleased to introduce our two speakers today, Dr. Ffion Curtis and Dr. Michelle Maden, who will help hopefully untangle us maybe a bit, give us some advice on how to do equity sensitive research when it comes to evidence synthesis. And both Ffion and Michelle are lecturers based at Liverpool University, lecturers in evidence synthesis, and they bring with them extensive experience and expertise on systematic review methodologies specifically. They're collaborators of the ARC Northwest Coast, and I should probably mention that Ffion is also part of the leadership group of the Midas evidence synthesis subgroup in the ARC Northwest Coast. We'll put some information about that in the chat. I think if you want to join, the group is open. And Michelle is also a member to that group, but she's also done her PhD with the ARC Northwest Coast. So very pleased to have both of them with us. And without further ado, I will hand over to Michelle and Ffion, and we'll invite you to type your questions in the Q&A section as we go along. Because of the numbers that we have with us today, which is brilliant to see, it's almost 100 people now. We won't be able to have everyone unmute themselves at the end, but if you put your questions in the Q&A section, I will do my best to feed all the questions to the speakers at the end for their feedback and comments. So thank you very much, Ffion and Michelle. Over to you.
Fabulous. Right, I'll just make sure we can share our slides. Okay, so okay then, so can you see my slides? And can you hear me?
I can, Ffion.
Oh good, I was a bit worried.
Yes, it's all good, thank you.
Brilliant. Okay then, so yeah, hello everyone. It's great to see so many people joining today, and welcome to our Introduction to Evidence Synthesis webinar. My name is Dr. Ffion Curtis, and I'm a lecturer in evidence synthesis within the Liverpool Evidence Synthesis Group. I've been working in evidence synthesis for over a decade now, with growing interest in health equity in the context of evidence synthesis methods. Within my previous role at the Centre for Ethnic Health Research at Leicester University, I co-developed an equality impact assessment tool specifically for use in evidence synthesis, which I'll say a bit more about later on. Also, over the last year or so, Michelle and I have been collaborating with some lovely people, to include colleagues from the Campbell and Cochrane Equity Methods Group, looking to develop a health equity toolkit. So whilst I definitely don't feel like an expert, I have spent a lot of time reading, thinking and collaborating in this space. We're glad to be able to share what we've learned with you today, and I hope this overview is useful. So over to you, Michelle, to do a quick introduction.
Hello everybody. Yes, I'm Dr. Michelle Maden, and I am also a lecturer in evidence synthesis at the University of Liverpool, where I've been for 11 years now at the university. 2 years in the role of lecturer, but I started off doing my PhD through the ARC, and my PhD thesis examined or looked at the incorporation of considerations of socioeconomic inequalities in systematic reviews. So it was a methodological PhD that aimed to kind of enhance, I suppose, an understanding among novices like myself, who didn't have any understanding of public health or health inequalities, trying to get people like me to think more about how how important it is to consider equity within all research, not just evidence synthesis, but the focus of my specific work was around a particular inequality, socioeconomic status, within the context of intervention reviews. And I will talk more about that later on. Thanks, Ffion.
Well, okay then, so if you're here today, we're going to assume you are interested in health equity and evidence synthesis, but what we're not going to assume is a level of knowledge on the topic. So we'll begin with some brief definitions, a bit about the background to provide some context, and look at when we first became aware of the concept health equity. We'll examine current practice. Whilst this is a topic of great interest and there has been a drive to consider health equity across all research, currently very few published reviews incorporate health equity considerations. So we'll have a look at perhaps some of the reasons for this and how things are changing moving forward. During this workshop, we'll also discuss the different resources available to support reviewers in incorporating health equity in evidence synthesis, and challenges faced and future directions. So we know that all health research should be conducted through a health equity lens, and there's increasing recognition of the importance of this, as reviews are a key resource for health decision makers. So evidence synthesis combines the findings from multiple studies. Types of evidence synthesis include meta-analysis, systematic, rapid, scoping, qualitative or umbrella reviews, to name but a few. I think one of the key things to note is that we do use a broad range of different evidence synthesis approaches to inform healthcare policy, practice and research now. So evidence from these reviews is produced from a combination of published and unpublished sources. And one of the main features of these reviews is that they use formal, explicit and rigorous methods to summarise the best available evidence on a topic, following a detailed and comprehensive plan. So these plans, as we all know probably, will often include the roadmap that stipulates in advance the rationale, theory and structured methods of addressing a research question, which include critically appraising the included evidence. But what we don't currently have is formal, explicit and rigorous guidance on how to incorporate health equity considerations across these different evidence synthesis approaches, considering the kind of multi-dimensional concept that health equity is. And further to this, we are hindered by confusion over terminology, as a recent review concluded that there is still a lack of consensus over definitions of health inequality, inequity, and how researchers operationalise existing methodological guides within evidence synthesis. Ooh. So let's have a look at what we mean by health inequalities. So healthcare outcomes vary across the population, and differences are often based on factors that can be avoided and are referred to as health inequalities or health inequities. These terms are often used interchangeably, and also the term health disparities can be thrown in there as well. So to start with, there are a number of factors that contribute to health inequalities and inequities, and examples of these include personal characteristics such as sex, age, ethnic group. We've got individual lifestyle factors such as smoking or physical activity levels, social and community networks, living and working conditions, and then general socio-economic factors also around disposable income, availability of work, for example. So health inequalities is defined as the differences in the distribution of a specific factor between different population groups, while health inequities refer to these inequalities, but this is where the outcome is unnecessary and avoidable and unjust and unfair. So we can see here we've got the two most commonly used definitions there from Whitehead. But what I do think is when it comes to unnecessary, avoidable, unjust and unfair, sometimes this can be a confusing and difficult thing for researchers to confirm or identify. So let's just have a look back. So when did we first start thinking about equity? The integration of equity into evidence synthesis has been a gradual process with significant advancements only in the past few decades. Setting up the basic tone and essential principles for health equity more broadly began when the WHO in 1946 proposed that, as a fundamental human right, every human being is entitled to the highest attainable standard of health without the distinction of race, religion, political belief, economic or social construct. So I'll just leave that there for a moment. So that was 1946. How are we doing now? And then the first publication was about 1966. And these early efforts laid the groundwork for understanding health equity as a multidimensional concept in health. Then the WHO's Commission on Social Determinants of Health, established in 2005, significantly influenced the integration of equity in health research, including evidence synthesis. And then we move on to the development of frameworks like Progress Plus. This helped structure the consideration of health equity in research around this time. PRISMA Equity 2012. So this reporting guideline specifically developed to focus on equity and systematic reviews, making a formal step towards integrating equity considerations into evidence synthesis. And then it was only in 2020 that a chapter about health equity was included for the first time in a Cochrane handbook. And there's also a series of health equity training modules added as well on their interactive learning platform. And then a significant step forward in this space was the formation of the Campbell and Cochrane Equity Methods Group. And this was formed to encourage the inclusion of a health equity lens in evidence synthesis. And of course, now we have leading medical journals updating their guidance for authors on the reporting of data dealing with equity factors such as race and ethnicity. So there's definitely a big shift now and a recognition of the importance really widely about the consideration of equity in all research and importantly in evidence synthesis. Over to you, Michelle.
Thanks, Ffion. Yeah, so where do we want to think about equity in terms of evidence synthesis? And I think if you can see on the right-hand side of the slide, really, I mean, it doesn't really matter what type of evidence synthesis you're undertaking, whether it's a systematic review of intervention studies, whether it's a qualitative review, whether it's mixed methods, whether it's a scoping review, whether it's anything else. I mean, the underlying sort of methodologies are pretty standard for all types of evidence synthesis, and they're obviously tailored towards different areas, but principally these are the kind of key stages that you would see across the broad different types of evidence synthesis. And ideally we'd be wanting to think about equity from the very go really as well, thinking about it in terms of the stakeholders that we involve in our review as well, that the question formulation or questions that we want to talk about in relation to different populations. We may need to consider it in relation to our search terms, particularly if we're undertaking an equity-focused systematic review, and where we search for that literature as well. And the type of literature also needs additional consideration. We should be considering equity frameworks really to help us to support our data extraction tables so we can see any patterns or gaps across any of our equity characteristics. And they should, equity considerations, I should say, should actually inform our analysis plan as well. Whether the review is equity focused or not, it's still relevant to find out whether equity does have an impact on our review, regardless of whether the focus of our review is a particular disadvantaged population or not. So we're trying to encourage everybody to think about equity regardless of whether the review is an equity focused review, and it can be embedded throughout all of the different stages of the systematic review. So we can take very much a pragmatic approach to consider equity, and we have guidelines and frameworks available to us to enable us to help us with that process. And over the next few slides we're going to look at how we're doing, what tools are out there to help us do that. Okay, Ffion, could you please move on?
Yeah.
Thank you. Yeah, as part of my PhD, back in 2016 now, I have to say, it was quite a while ago, the first part of my PhD was to look at a mapping review of some of the guidance that was out there to help people doing systematic reviews to consider health inequalities. And that review identified around 20 guidance documents at that time that were published between 2009 and 2016, with the majority of them being published by the Cochrane collaboration at the time. And it's been produced to inform considerations of health inequalities at different stages of the systematic review process. But what I found was that most of the guidance was largely focused around the conduct and planning stages around systematic reviews of interventions. That's not surprising given the focus of Cochrane around effectiveness of intervention types of reviews as well. And in terms of inequalities, most of the guidance had an equity focus, meaning that it was specifically created to support considerations of equity. And of these, 3 of the guidance documents focus specifically on sex and gender inequalities, 1 on socioeconomic status and 1 on both sex and socioeconomic status analysis in systematic reviews. And I think the take-home message really was that the guidance was starting to emerge, but was very much largely focused on intervention reviews. And there is a lack of clear guidance on how to actually operationalize the guidance in terms of pathways and interactions of these different inequality dimensions and their potential effects on outcomes of interest. And there is a lack of guidance also on how to consider health inequalities in other types of reviews besides intervention reviews as well. Now, bear in mind that that review is now 9 years old. We are actually planning an update to this review as well as part of some of the work that we're doing already. Next slide, please, Ffion. Thank you. So how are we doing now then? Okay, let's look at some of the if we look at some of the methodological studies that have explored the use or considered how inequalities have been used within systematic reviews. One of the first methodological studies that was undertaken was back in 2012. And they found that from a sample of 224 reviews that assessed the reviews of the effectiveness of interventions, only 29 of them, or 13%, actually had considered equity within their particular review, using either subgroup analysis or targeted analysis of vulnerable populations. Of these, 7 had actually conducted subgroup analyses related to health equity, which were reported in insufficient detail to judge their credibility. And not a direct comparison, but we were doing some work sort of like towards the end of last year around seeing where we are now in terms of health inequalities and their consideration within reviews. And we did a little search in Medline. I have to say that's September. It should be maybe 2024 we did it, not 2025, because we looked at a sample of systematic reviews that were being published in September 2024 to explore how frequently health equity was considered across different types of evidence synthesis, not just intervention types of reviews as well. And we did a very quick search in PubMed, and we used a health inequality search filter and systematic review as the publication type to retrieve a whole different range of evidence synthesis approaches, focusing on health related topics, but not specifically reviews of interventions. We found around about 2,500 reviews, of which only 160, which was 6.2%, had actually considered health equity characteristics as part of their review. And based on our consultations with the wider evidence synthesis community and the increasing recognition of the importance of conducting evidence synthesis research through an equity lens, we suggest this is probably more due to an absence of a usable, relevant resource rather than an absence of motivation from researchers to consider equity in evidence synthesis. I suppose really it brings back memories of when I was doing my PhD and I first started off. I mean, I really kind of I am a methodologist. I should have explained that at the start. By background, I'm an information specialist by background. With no real experience or understanding to any great detail or depth of health inequalities. So to me, that was still not surprising, is that the tools are there. And what I found when I started first using these tools and looking at the tools as a novice in the area was really trying to understand how they could be operationalized within the review to help us to think about the ways in which inequalities may arise as well. So overall, really, there was limited consideration of inequity in evidence synthesis, and it's still sort of filtering at that level today as well. And this is really at odds with the growing research interest in this particular topic. And I'll return to you, Ffion. Thank you.
Yay, thanks, Michelle. Sorry about the 2025. Michelle would never put the wrong year in there. That was definitely me. Okay, then. So what resources are there? So we've just pulled together a kind of brief overview of some resources that have been relevant to us recently. So I know there are different ones. And obviously, if you're interested in having a look a bit more widely, I would refer you back to Michelle's paper. So as we've previously mentioned, Cochrane do have the equity in specific populations chapter that focuses on integrating equity considerations into systematic reviews. And this is to ensure that health interventions are effective across diverse populations. And the chapter provides guidance on how to incorporate equity into the design, conduct and reporting of systematic reviews. And it uses frameworks like Progress Plus that we are going to have a bit more of a look at in a few slides now. It also encourages the use of subgroup analysis and other methodological approaches, such as the importance of stakeholder engagement, particularly involving those with lived experience of health inequalities in the design and implementation of the systematic review. And I think that's something that we're all becoming more familiar with now. And obviously they've got their interactive learning module that are quite useful as well, I think, if you're working in this space. And we've got the PRISMA checklist, and this was developed to improve transparency and completeness of reporting of the systematic reviews. But this is of intervention studies with a focus on health equity again. And then we've also got Progress Plus, Pro-EDI, HIAT, the EQIA and the Kanonga framework. And we're going to touch upon each of those a little bit more over some of the subsequent slides. So this slide is a graph taken from a review, methodological review by Kanonga et al. And it just provides a kind of a nice overview over the years of how we're incorporating the equity tools. So there were two predominant guides identified, Progress Plus and PRISMA Equity, that are designed to support the introduction of a health inequity lens into evidence synthesis. So on the graph there, blue is for Progress Plus, orange is for PRISMA, and grey is for both. And this shows the number and gradual increase of reviews that explicitly evaluated health inequality or inequity. Each Progress Plus disparity category and those used in the PRISMA equity checklist. The reviews assessed either health inequalities or inequities as the primary factors, some of which use the terms interchangeably throughout their analysis. And I think it was only 18 of the reviews from a total of 62 provided a definition of inequality or inequity within their studies. So majority of resources available will actually signpost you to Progress Plus. So I thought I'd take a moment just to show you what it looks like. Because as part of our planned research, we've facilitated some consultations. So we had some focus groups with 8 participants in. Most of them had actually conducted equity reviews, and 2 had used equity resources. So I think the thing is, there's lots of reviewers are not as familiar with this tool as we might expect. So our reviewers that came to our focus groups, the participants, had expertise across a range of different evidence synthesis approaches, to include mixed methods reviews, qualitative, prognostics, prevalence, and reviews of intervention studies. Most of them had been conducting evidence synthesis for a range of 4 to 15 years. And despite their expertise, it was surprising that not only had some of them not used the equity resources, but some of them weren't sure what resources were available, which ones would be appropriate, and also where to find them. So one of them said that was the general kind of feel from the group. But one of them said that they tried many times to look at inequalities and find it really difficult to do so. We also explored the perspectives of members of the public, and all of those that consulted felt it was very important that equity be considered in evidence synthesis, because it's used by decision makers, ultimately informing health and social care services and health related interventions that would affect them. And they discussed the importance of understanding health inequities and then acting on this information to avoid the unfair differences for different people. And one statement was, during the pandemic, words like health inequities were being thrown around on a daily basis, and it's about time we all started acting like we know what this means and then doing something about it. So I feel like we've all really been put in our place by some of the comments in those focus groups. So here's just to show, I'm sure some of you will have seen this, some of you won't. So this is the Progress Plus framework, and it's endorsed by the Campbell-Cochrane Equity Methods Group to guide the conceptualisation of disadvantage for data extraction, really, and to inform equity analysis in reviews of interventions. So the acronym Progress Plus identifies dimensions across which health inequalities may exist. And it looks at things like place of residence, race, ethnicity, culture, language, and so on. And the plus in Progress Plus refers to any additional factors across which health inequalities may exist, such as age, disability, and sexual orientation, just as some examples. But the Progress Plus doesn't necessarily ensure or guide critical thinking about more complex pathways, including interactions between the dimensions of equity and with wider contextual factors. Important practical measurement and conceptual challenges remain. So as a tool, at face value, it is fairly unidimensional, which health equity is not. So then providing a little bit more structure and building on Progress Plus, the Pro-EDI is an ongoing initiative. So this offers a framework for the extraction of equity characteristics from the primary intervention studies. So it just provides a bit more guidance and a bit more structure. So you can see down the left, we have the equity equality factors such as age, gender, socioeconomic status, and then it provides an explanation on how to complete this item. So it suggests what data you might be extracting for this. So, you know, for age, it might be mean or median. For things like socioeconomic status, it suggests using the categories used by study authors. And I think it does that across some of the others. But it is helpful to have this extra additional framework, I think, layering on top of Progress Plus. And I know that some of the reviewers from our consultations have been using this tool and found it a really helpful addition. So what is also helpful is they're beginning to introduce some more guidance on how to use the extracted data as well. So this is from a study looking at interventions for preventing falls in older people. And it asks, are we seeing the right people in our studies? And through this process, reviewers can actively consider who would they expect to see included, and then were they? So, for example, age. We would expect to see people who are older, average age over 65 years. And yes, all the included studies involved people with mean ages generally over 70 and 80. Then if we move down to ethnicity, so links have been made to ethnicity and falls, often mediated through other factors, but we would want to see this data for our review. So what they say here is the data from the primary studies was not available for equity considerations. So you can see how in this instance you'd be picking up on a case the primary studies aren't reporting the data required, and this might be part of your review reporting. You might consider it in terms of equity, but also in reporting recommendations for primary studies, which I know we are seeing much improvement in mostly. So you can see how these resources are building on Progress Plus to provide that framework to start helping to guide reviewers in a bit more detail again. Oh, Michelle.
Thanks, Ffion. So this is just a slide from my thesis as well, which kind of outlined a framework to kind of help reviewers consider how equity can be considered throughout their review pathway as well. So the slide before basically focused very much on the populations of interest that were included in the primary study, whether they were included and what we'd expect to see and so on. This kind of framework helps you a little bit further more down the line. It's a theory-led meta framework that actually combine two theoretical perspectives from socioeconomic inequalities and complex intervention theory into a single framework to enable considerations of socioeconomic health inequality considerations and systematic reviews. So the focus of my PhD, I should remind you, is that it was very much just on socioeconomic status rather than the other broader characteristics as well. But there's nothing to say that this type of framework couldn't apply to across the other different characteristics as well. Focusing on inequality theories, really, it looked to explore the factors that were associated with an intervention in terms of how an intervention is delivered, how it's put together, and the context around it that may result in differential effectiveness of an intervention. And these are highlighted in the blue areas of the framework as well. But it also, more importantly, takes into account the mechanisms around how an individual and their personal context may respond along the pathway of the intervention that may then result in differential effects. And these are the boxes highlighted in sort of yellow, cream and orange in kind of the middle. And that was the interesting bit for me, because this is where I struggle to kind of understand how inequalities or equity characteristics matter in the context of systematic reviews of interventions. Could you move on to the next slide, please? Thanks, Ffion. And I'm just going a bit closer in on the mechanisms really here to kind of help, I suppose, operationalise, which was one of the key things that I was interested in really. How can we operationalise these considerations of equity within our systematic reviews as well? And if we look at two of the mechanisms just in a little more detail, we can start to understand how it may impact on the effectiveness of an intervention and potentially lead to differential effects. And the most direct way in which it can do this is through an individual's ability to control the effectiveness. So in other words, it's how their general characteristics, such as their age and their comorbidity or ethnicity, may have an impact directly on the effectiveness of a specific intervention, be it a drug or another type of service-led intervention, for example. So in this example, treated bed nets for preventing deaths from malaria may actually result in a reducing of inequalities when the risk of mortality is higher at baseline in terms of disadvantaged individuals. So we're thinking about the individual's baseline characteristics essentially and how they may moderate the intervention effectiveness. And that's really the most direct way in which we can consider inequalities. But if we look further and look at more indirect ways in which inequalities can have an impact on effectiveness. It can be more around how populations and disadvantaged populations may be able to access the interventions. So, for example, the ability of an individual to pay for a bed net may widen inequalities, as poorer populations may not necessarily be able to afford them. So we need to consider the wider picture really in terms of what the intervention is and how it may be implemented, and whether it is likely then that differential effects may be observed across the different populations. And we need to think about this at the start of the review, because this will enable us to kind of operationalise our approach to what we need to extract in terms of data, what we perhaps need to analyse as well in terms of whether we can come to an understanding of if and how inequalities matter within our particular review. And it may be that they don't, but I think it's always important to consider whether they may. Thanks, Ffion. Next slide. I think it's back to you.
Fabulous, thanks, Michelle. And I think this frameworks and using logic models and visual representation can be really helpful in thinking about equity and the pathway of health equities. So going back now, so this is the toolkit that I mentioned at the start. So this equality impact assessment is a toolkit, and it includes tools specifically adapted for reviews. And it signposts to a range of additional resources to obviously include Progress Plus, and includes prompts to consider health, equity, equality issues across the different stages of a review. It considers each protected characteristic individually in relation to the main aims of the review, the research question, eligibility criteria, subgroup analysis, PPI, dissemination, across all of those processes as relevant. And there are important considerations across all of those processes. For example, the inclusion eligibility criteria. So to only include larger studies, for example, would likely exclude research studies conducted in specific community and low middle income contexts, which may then potentially exclude specific protected characteristics groups. And that is from an example of when we did an equality impact assessment with a group, and that was one of the things that they had to think about within their systematic review. So what is quite interesting with this, I think quite helpful, is it comes in two parts. So it asks you to consider equity considerations, equality, across the different stages of the review. But then the first part is carried out prior to conducting the review in order to understand its potential to include equality issues. And then the second part is to be completed after finishing the systematic review. And this is in order to reflect and record any equality issues that can then be reported within the review. And it provides guidance on how to complete and also signposts to the additional resources, so reviewers can go to a higher level more in depth if they wish as well. And it describes what would be a positive or negative impact, and of course no impact or unknown. So I've seen this form applied successfully, and it highlights issues, and reviewers have fed back that it's really helped them in the design and stages to reflect on equity. But it does require additional resources in terms of time to complete. And so whilst we can see the pros and cons, I think we are all in agreement that it's an important part of the evidence synthesis research process. Then, of course, so the previous tool, was from the NIHR East Midlands ARC, which is where I was based prior to coming to Liverpool. I've been at Liverpool for about 2 years now. And this tool is from our Northwest Coast ARC, and it's the HIAT. So perhaps some of you are familiar with this. The HIAT aims to support people to integrate an intersectional equity lens into research and consider how people with lived experience and policy or practice expertise can help in this process. So it wasn't developed specifically for evidence synthesis, but has been applied in this context due to its more broad approach for research in general. And it has 5 sections, and throughout it asked researchers to reflect on how you can embed an equity lens throughout the research process. And across this, how they can involve people with a relevant lived experience and dive deeper into issues raised. And there's links throughout to the additional resources, including examples how other researchers have addressed the issues covered in each section. So rather than step-by-step guidance, it provides overview recommendations, hence its applicability across different research designs. So in one part, it asks about mapping health inequalities relevant to the research considering the topic, and which dimensions of health inequalities are relevant and how they may intersect. Then number 2, thinking about how can the research question, how can it be framed in a way that enables the identification of potential inequalities and explore their causes. 3 is thinking about the research design and structural causes of inequalities and identifying any differential impacts and experiences. And then 4 is looking at the most effective way to share findings relevant to understanding or reducing health inequalities. So thinking about target audiences, and also considering the potential whether research findings and the dissemination could inadvertently contribute negatively to inequalities, and thinking about how this could be avoided. And then finally, number 5, principles for research that are sensitive to intersectional inequalities. And this requires consideration about making implicit assumptions or having implicit biases that may influence the research, and how you might mitigate against these. So you can see this is quite a broad overview tool, and its potential for being applied in evidence synthesis, which it has been. So here's a really recent tool that's been developed, and whilst not tested or validated, this Kononga framework, whilst not validated and tested yet, proposes to offer a structured approach to embedding intersectional life course perspectives and evidence synthesis, supporting policymakers and researchers in designing more effective inequity focused interventions. So it highlights the relevance of life course interactions. For example, evidence exists that health literacy can be affected by various factors, including gender, age, race, income, place of residence. So how this framework is set up is it looks at the protocol stage, where reviewers are asked to explicitly define health inequality and inequity, select frameworks like Progress Plus, and develop a logic model to map pathways between social determinants, life course factors, and health outcomes. Then during data extraction, it suggests organised data by demographics, socioeconomic and healthcare factors to detect patterns of inequality, inequity. And then the final step within this framework is looking at the analysis and intersectionality matrix and life course analysis to help reveal overlapping social determinants and cumulative effects on health outcomes. This approach does take equity and evidence synthesis a stage further in considering the multidimensional nature of health equity, but it does require reviewers to have some background knowledge in health equity. So you can see there we've got a range of different existing tools. But what are the remaining challenges that we're facing? So existing resources for embedding equity systematic reviews, they are narrow in scope and are predominantly designed for reviews of interventions and those focusing on health equity topics. And often they will lack adequate detail to guide reviewers, although Pro-EDI has been developed with quite simple guidance and steps to help reviewers to operationalise equality considerations across their reviews. So these challenges were reflected in our consultation work as well, where we found there's a desire to incorporate equity considerations within the different types of reviews. For example, the reviewers conducting qualitative prognostic, for example. But the equity considerations are lacking. So an example quote was, resources for prognostic reviews are 20 years behind everything that was developed in the intervention space. And thinking back to our timeline where equity and evidence synthesis has been developing over the last couple of decades, this does mean that equity resources for other review types are really lagging behind. And also just to mention, Pro-EDI does actually suggest that this resource could be applicable to other study designs beyond intervention studies, but currently there isn't further guidance for reviewers, so that might be more widely applicable moving forward. So existing resources can be complex and burdensome reviewers, and require a certain level of knowledge in relation to health equity. So within our consultation, we did find that reviewers were put off by complexity and additional work required. And some of the quotes included, so you can see these in the context of developing future tools, but these are just examples of some of the quotes. So one reviewer said, I don't want to have to read through pages of information to find out, you know, the tool that is not relevant to their review. And another one has concerns, will it create more work for me? And here's some of the other challenges that remain. So there's inconsistencies in the way inequality or inequity is addressed and reported in evidence synthesis, hindering progress a bit in this space. Existing resources do require some previous knowledge of health equity, and they are limited in their ability to provide a roadmap for reviewers that can enable them to visualise links and interaction between some of the various factors. And also a common issue is reporting in primary studies. Often factors are not reported here, or there's heterogeneity in how they're described, and that makes it really difficult for reviewers to consider it within their reviews. So moving on to have a look at future directions. So to provide clarity in relation to equity, equality, and yes, I am aware that I've been using both the terms quite a lot throughout this, review authors need to provide definitions within their reviews. Looking back at the Kanonga methodological review, from the 62, only 18 of them provided a definition of inequality or inequity as they were using it within their reviews in their studies, and most use these terms interchangeably, which does cause confusion for readers. So to meaningfully address the effects of inequality and equity, simply stratifying along the relevant progress plus factors may not be enough, and we should be exploring concepts such as intersectionality and the life course perspective on health, as the Kanonga framework is proposing to do. But at the other end of the continuum, we also need guidance for less experienced reviewers who don't have significant knowledge of health equity, but we still need these to be considered, or at least highlighted within review findings. It's important to consider to also ensure that the review methods don't introduce or perpetuate existing inequities. The integration of a health equity lens in research and systematic reviews has definitely gained prominence over the past 2 decades, driven by global health goals and the need for evidence that addresses health inequities. And the development of specific guidelines and frameworks has facilitated this shift, aiming to improve the relevance and impact of systematic reviews on health equity. But honestly, there are still significant gaps in terms of resources to guide reviewers in considering intersectionality of equity characteristics and accessible guidance to guide those reviewers conducting different types of evidence synthesis with varying levels of experience and expertise. So this is where I'm going to leave it today, just to add that we are developing some work looking to develop a toolkit in this space, a simple guide for reviewers looking across different types of evidence synthesis. And if you'd like to know a bit more about this or would like to contribute in some way, we've submitted for funding, we've got our fingers and toes crossed, but we're really keen to involve interested parties, varying levels of expertise in evidence synthesis and health inequalities. And by varying, we do mean total expert to novice, perhaps completing their first or second review, to provide input on the tool development as we move forward, fingers crossed. And also, just to let you know, we will be running an in-person workshop in the not too distant future with a practical session where people will have the opportunity to apply existing health equity guidance and resources to an example systematic review. And this will include thinking about health equity in the design, conduct and reporting of different types of systematic reviews. So we do hope to see some of you in person moving forward. This will be quite an informal workshop where we'll be able to talk about all issues relating to health inequalities and the different resources that are available. But for now, thank you for your time. I hope this session was helpful, and any questions? I'll unshare the slides.
Thank you very much, both.
Okay.
I think that was a very thorough presentation in what it is, and it did flag all the challenges that are still out there. So there is much reason to be discussing this in how we take practice forward. Certainly not at a perfect state. There is a lot that we can all do in practice moving forward. Everybody, please do put in your questions in the Q&A section. We'll try and pick them up. So you mentioned this, I just want to reiterate it. If I'm someone who wants to go ahead and do an evidence synthesis review, want to take a health equity approach to it, but looking at the primary studies, health inequalities is not something that is reported on. What do I do at the minute? What are my options? Just to reiterate what we should be doing in practice at the minute when things are not perfect.
So are you saying when the primary studies aren't reporting the data that we would want in there?
Mm-hmm.
Yeah. So I think it's really important to consider the characteristics that you would expect to see within these primary studies and use a resource such as Progress Plus to work through important factors, but then make sure that you're highlighting this in terms of reporting the review as recommendations for those primary studies, and also to still consider the impact in terms of your topic and what this, just to highlight that there may be equity issues in relation to the missing characteristics, but you're unable to provide further information without that data. I don't know. Did you have anything else to add, Michelle?
Yeah, I think, I mean, I did a piece of work around this as well, because that is one of the main issues for facing reviewers is that there is such a lack of data on equity, and there's a lot of work to do to get that sorted, from a systematic review point of view. But this is where theory comes into play in terms of evidence synthesis methodology as well, and thinking about the theories around inequalities and how we can embed them through the systematic review process, which will strengthen the applicability of our findings in the event that there is no, or there is a lack of evidence out there as well. So it's knowing a little bit more about, planning out ahead, thinking and considering, looking at some of those theories that kind of give an explanation for potentially the way in which we may consider or need to consider differential effects, and to kind of embed that through the introduction sections of our systematic reviews. So we acknowledge that there may be an issue. When we do find out that there is a lack of data, we can go back to the theory to kind of say, well, the theory suggests that there may be an issue, and so we can still talk about it as well in that sense. And I think if you're ever doing, that type of work, that it rather than bringing in that supplementary evidence in an ad hoc way in the discussion section to say, well, this might lead to inequalities. If you look at the theory and you've embedded that throughout, you have a stronger, more confidence in your review findings to suggest that there may actually be differential effects, and we just need to be a little bit more cautious.
Brilliant, thank you both for that. And I guess you did refer to some of the tools being rather unidimensional, so not necessarily being reflective of the complexity of concepts like health equity. So Gareth had a question asking, how should we then think about addressing the more complex pathways, the intersectionality within this, and would that be possible without taking a fully qualitative approach or having to rely on massive quantitative data sets that we don't necessarily always have access to?
Okay, so I think currently that I would say that there's not a perfect answer to that question, and I think the Cononga framework is quite promising within this space, but currently I would suggest using a combination of tools, and I think that's probably where the problem comes in, because where the HIAC tool does begin to reflect on intersectionality, for example, and then combining that with bringing in some of the other tools as well. Michelle?
Yeah, and I think logic models and program theory really will help with that area as well, to consider it. It's definitely a PhD area for somebody who's willing. This is it. I mean, the work in this has been ongoing for some time, but I don't think it's necessarily progressed in any, it progressed far enough, shall we say, to what we need it to be at now, for those more advanced conversations around intersectionality. Yeah, so I would definitely say, wow, this is right for a PhD.
Yeah. I also think people might get a bit scared off sometimes by the
Yeah.
term logic model and overcomplicate it. And I think that there, you know, you do need somebody potentially with some experience, but people can, you know, work quite simple logic models to start thinking about it as well in this space, I think. And it really does help to visualize the pathways.
Brilliant, thank you. And Nasima, she's saying, given that equity is a difficult concept to define and measure quantitatively, what are your suggestions?
That's the difficulty, isn't it? I mean, I know from my experience of doing throughout my PhD, when I was looking at socioeconomic status, it's defined in so many different ways across different sort of countries as well, not just, you know, and even within a country, the definition may differ as well, and it's a difficult one to kind of work with really as well. So I don't have an answer to that at this minute in time, I'm afraid, and we just have to point out that these are the issues, and hopefully someone will come along and say, actually, this is somebody with more experience in health inequalities, perhaps in public health, and with that kind of background can work with the methodologists to kind of address those issues. So sorry, I can't answer that question.
That's all right. Speaking of how things are measured and what factors are included when we speak about equity, I think there was a question that came up when you were talking about your model, Michelle, but may apply more widely as to where does disability fit into this? Alan was asking.
Well, I think it definitely comes in the Progress Plus in terms of the plus characteristic. So it's not that it's being ignored, it's perhaps just not being explicit in the existing research. But if it is a characteristic that's important to consider, then, you know, there's no reason why it can't be highlighted as well.
Great. And then Emily's also asking, is there a particular resource that is more suitable to non-intervention reviews?
I think both of the tools developed by the ARCs, so the HIAT and the Equality Impact Assessment tool, are not specific to intervention studies, and they do also signpost a map across Progress Plus and moving forward potentially the Pro EDI. But yeah, so I would say those approaches, logic models. I think the others really are targeting intervention and or equity focused topics as well. So I think that's where the current challenges are at the moment.
Great. And then Savvy says, you know, sometimes we've got groups that are seemingly similar demographically, at least on paper. How can we take that on board during evidence synthesis? And she gives example of the effects of a certain mental health intervention on, let's say, middle-aged South Asian men in San Francisco in 2007, and then in Tower Hamlets in 2012.
So I'm just trying to understand the question. So we're looking at intervention in the same population, but with the slight...
So they appear, I guess, to be similar demographically, but actually they are different populations. So how do we take that into consideration when we do the evidence synthesis? I guess it goes back maybe to what data is available from primary studies.
Yeah, afraid so. Yeah.
So
if I'm interpreting that wrong, please feel free to add a comment to your question.
Perhaps it's what data is available from primary studies, and then would it be appropriate, whether would there be the potential for a subgroup analysis, looking at the analysis stage if that data was available? And I think it does all come back to that, because that's what we're limited with in evidence synthesis a lot of the time, which is different to primary research. It's just whatever the primary studies report as well.
And then Andy is saying, you know, if the approach then is to like push for reporting on equity issues as a standard part of whether we're doing trials or other types of studies, but then also systematic reviews, if funders required it, that would obviously help if it was a requirement that we did that. Do you see that coming? Is that an ongoing discussion with funders that you're aware of? Is that going to become,
as far as I know, didn't NIHR already kind of ask for that as well now within some of their funding streams as well? They've got they have an inequalities consideration part as well. I think anyway, from what I remember of our last application, we did get asked about it.
Yeah, I think funders and journals, I think moving forward, it's being introduced across the board, but will become much more of a requirement. So I think it's something that we all do have to work with, understand, and apply more within our work.
Yeah, and I think it makes sure, if it's not there as a requirement through funders, it would make your application stand out if you did include it. Is the key, really.
And then you mentioned a lot of the Kanunga framework. So there's a question, is that accessible to relative novices? Or will they have to wait for a new toolkit?
I think it's a relatively new framework, so it's difficult to comment because I haven't applied the framework myself. But I think it would require some background knowledge or definitely some work around the topic to apply it. But I wouldn't let that put somebody off reviewing it and considering it for their use within a review, because it's definitely got potential in this space. I think it really is helping move things forward.
And then you also mentioned during your consultation, most people weren't aware of resources out there, or where to find them, how to access them. Of the people that you've spoken to who have used one tool or another, were they able to, I don't know, go wherever they could access it, let's say the developmental paper, read about it, and then apply it? Or do you find that people need more support, more training in tools before they're able to implement them in their own research?
I think from what I've seen in terms of how they're being currently used in systematic reviews is they're very much used as a descriptive tool to say, was the data collected and was it analysed, rather than necessarily considering more in the analysis and the implications of those findings later on. I think that's where there's a gap in terms of the operation. The operatic, oh gosh, I can't even say the word now.
I fell over that word earlier too. I've caused this
it's
trouble.
Dreadful, isn't it? Oh god, whatever. Implementing. That's the one. Yeah, that's the word. Thanks, Katerina. Yeah, I think that's where the gap is really. Is just there. Yeah. And that's my area of interest is, how can we help those people who have no experience of inequalities and didn't even think it was an issue, consider it as part of their and it's not just in evidence synthesis, is it? It's research in general, but obviously we're specifically interested in those methods around evidence synthesis. So maybe there's some collaboration that needs to be done across different areas of research to kind of look at that in more detail, because maybe it's a wider issue, not just an evidence synthesis issue.
And maybe the other thing to say is as well that with most of those tools, they've not been developed for somebody to sit in front of a screen and complete it themselves. You're supposed to be working within a research team, having in your people with lived experience, having in different stakeholders, expertise coming from different sides and disciplines, so that they can all contribute to also understand that side of health inequalities. What does it look like? How do we measure it? Would that be, possible or not? What would we expect to find in primary studies to then even look if it's there? Because sometimes it might be that there's a proxy measure or something has just been defined in a different way, but it's not all put on an individual to have all the answers. So even if you're a novice, you're still expected to be working within a team to come up with answers, right?
Yeah, and I think we're quite good at that in evidence synthesis, and like lots of the processes would require, reviewers to work independently, but then come together and discuss. And I imagine there'll be an element of that in the methodological guidance for conducting equity considerations within evidence synthesis moving forward. So yeah, and also, pulling in the expertise of the wider team. But I definitely think this is a process that, it's not to be conducted sat by yourself at a computer screen, as you say.
Yeah, and Alison is rightly flagging that, that also has to do with the relationships within the research team when it comes to personal disclosures and maybe some hidden bias. So yeah, absolutely. That's why doing research with an equity lens also means you're having equity within your team and how you're doing things with your PPI, and you're working on those relationships. Absolutely. Yeah. Thank you both very, very much. I can't see any other questions coming up, so I'm just going to give people a minute, but I think that was a very thorough presentation. There's a lot of bits in the chat, people thanking you. It has been helpful, especially for those who not necessarily experts in evidence synthesis, and wishing you very good luck with your application going forward.
Oh yes, and I'd like to say as well, thank you. I've had some emails of people volunteering to be involved and interested in the work, so that's really good. And yeah, we hope today was useful. It was difficult to pitch it as an introduction session, so I hope we've managed to give everybody at least a little nugget of information that's useful.
I think you definitely managed to tick that box, especially taking in the comments. So thank you all very much for attending. Thank you to our speakers. Can I please also thank my colleagues, Dian Valkov and Sean Cunningham, who've been in the background helping with technology running smoothly and emails and advertisements coming out to you. We would be very, very grateful if you could take a minute to fill out our very brief feedback form. It's really short, but it's massively invaluable to us, in taking things forward and what we offer in the future. And there is some space at the end of the form. So if there are other webinars or a follow-up on this or any other sort of support that you think, we might be able to offer that would be helpful to you, please let us know, and we'll do our best to pick that up as we can. And as Ffion mentioned before, for those of you in the ARC Northwest Coast or member organizations, there will be an in-person workshop following this to explore things from a more practical perspective. So if that's of interest, spaces are limited, but they're all still spaces. And again, we'll put more information on that in the chat if you've not already received those emails. But thank you everyone very, very much. And yes, to answer your questions, slides and recording will be going out. We will send you all an email to follow up, and that's all available. But thank you very, very much.